I mean, all general practices are under pressure now, and they talk about the perfect storm. So basically, you would think that the government and the people who hold the purse strings, the people running the health service, would do everything they can to make GPs' lives easier, to make GPs' lives, practice nurses' lives, easier and more fulfilling, and make it easier to provide a good service for the patients. Is that your experience?
Not at all. Not at all. It's been a tick box exercise caring for patients in order to raise funds for surgeries for some time. That hasn't changed. The amount of time and the resources we've got to do it has crashed. It's halved, if not more than that. We're expected to jump through bigger hoops in order to get our money, and finding it increasingly difficult to actually get our money once we've done the work.
Give an example.
The easiest example is prevalence. We're paid per patient with certain chronic diseases. We've worked very, very hard to find more and more patients with diabetes. We are treating earlier, finding them. So because we're doing so well, they've actually taken away the payment for diabetes. So that's not on our prevalence register at all anymore. We're finding early COPD patients, and you're paid up to what is a national average, 100%. You'd be paid for your COPD patients, but if you live in an area that we live in and work in, we've actually got for COPD, I think our register is about 181%. So we're looking at after another 81% of our practice population with COPD with no funding, no benefit to actually looking after these patients.
You don't get a penny?
Not a penny.
Right. So what else is going on that's making life more difficult?
Things we are paid if we prescribe effectively and cheaper. We are paid enhanced service, a bonus if you like, for choosing cheaper drugs, so that the patients are obviously looked after well, but it's all an incentive scheme, and with that extra Brucey bonus that we get, we can buy another blood pressure machine. That's calculated all the time. We're always being penalised because with our elderly population, we've got a lot of homes using feeding and supplements, and they cost a lot of money.
Yeah.
But we are given this money kind of on a yearly basis to buy equipment, except we're owed, it's in the thousands, it's £3,000 or £4,000 from about 3 years ago. We're still chasing for this equipment. So we're spending time and resources chasing for money that we've not got to actually run the service. And this is only to buy another blood pressure cuff. It's not going to change the world.
What's the excuse for that? I mean, how can they not pay you what you're owed?
Because of the primary care trust debanding and becoming the CCGs, it kind of got left in the gap. It should have been a seamless transition of one business into another business. But conveniently it's been forgotten. So that's a battle that we're starting to fight. We're given money for enhanced services for helping people give up smoking. We're not being paid for that. For keeping patients out of hospital, we're promised funding for that. And you're talking about £5,000 that should have come into our coffers for our surgery that we're having to fight. We've done the work, we've coded it in all their lovely codes that they like us to use, we've helped the patients, but the money that they promised us hasn't come in, so that's extra work again.
So tell me about your phlebotomy service, because that's another issue, isn't it?
Yeah, in our area, they've decided from the 31st of March that phlebotomy won't be held in GP surgeries. That they have had a mass review. Our local hospital, Basildon, is now privatised. Their phlebotomy is now privatised, and they have rolled that out to include home visit blood testing and GP practice blood testing, and it will all be stopped at the end of the 31st of March. So if you've employed a phlebotomist, they've had to be given notice, so they will lose their jobs. The patients may have to go further afield, although at the moment they are promising a local clinic, but they haven't said where that's going to be. And obviously if a GP says this patient is chronically ill, or acutely ill and needs a blood test, it won't be able to be done in the surgery because, one, we probably won't have the equipment because it'll go out of date, and 2, we won't have a courier service to get it to the hospital.
So, I mean, the whole thing sounds bonkers, doesn't it? Because they are desperate to strengthen general practice, to stop patients going into hospital unnecessarily, to cope with patients in the community. They want 5,000 more GPs, they want general practices to be open 7 days a week,
Yeah.
and yet they seem to be doing everything in their power to make people wander off.
Absolutely. I mean, in our surgery, we've been advertising for 2 GPs to join our ranks, not on a locum basis, on a regular basis, and we can't find them. GPs don't want to come into general practice because they have to, 1, work too hard, because there's lots of hours and lots of very demanding patients and lots of hoops. So they have to work unsociable hours, they have to work late for very little reward. There's no money in general practice, and it is a business. You know, our business is good patient care, and we can't give good patient care, but the GPs also aren't getting paid for it. So there's just this mismatch.